Welcome to the Break the Cycle podcast. On today's episode, we have Dr. Kevin Simonson from Cura Behavioral Health out of Santa Monica, Los Angeles, California. He is the lead psychiatrist and medical director at Cura with over 15 years of experience. Today, we're going to be diving into Spravato. What's the difference between Spravato and ketamine? What are the indications, the contraindications, and the expectations that patients have prior to administering treatment? So join us on today's episode.
So is Spravato or ketamine a psychedelic?
Is ketamine a psychedelic? That's a great question. It is a psychedelic. It's a non-classic psychedelic, we would say, but it is the first FDA-approved psychedelic, technically.
Okay, so define a non-classified?
Non-classic, yeah.
Classic.
So a classic psychedelic is going to be like LSD, mushrooms, mescaline. Mm-hmm. It's going to activate the 5-HT2A receptor in the brain, a very specific serotonin receptor. Ketamine doesn't do that directly. It has a different mechanism. Mm-hmm. It works by NMDA receptor blocking.
Okay. And then how is it a psychedelic, if that makes sense? Like, what is the experience like?
Yeah, I think what we mean by psychedelic in the context of ketamine is that there's ego dissolution. Your sense of self can start to dissolve. There's also an altered state of consciousness that people might have visions. They might have memories come up. They are in a non-ordinary state of consciousness.
And I'm curious with the ego dissolution. Are there, and especially with just ketamine in general, are there stages to different ketamine doses? Like if you go, because I personally have experienced ketamine for suicidal ideations, and I think it was an IM injection, and it was just like a dark hole, and I was just laying there, So I've heard people that there's different tiers to it, and so you can kind of is that true? There's different type of levels to the psychedelic part of it.
Absolutely, yeah. So
okay.
low doses of ketamine we would say is more psycholytic in nature, meaning it's just going to be a lightly altered state. Okay. You might still know that you exist as a person, your identity, your name, none of that is going to dissolve. But at higher doses you might completely forget who you are.
Interesting.
And then what's typically administered at the clinic? Is it just case dependent, or how do you typically weigh that out?
Is it weight?
Yeah, it can be weight-based dosing. It can be case-dependent. With the Spravado, it's more tightly regulated in terms of dosing.
And what's the difference between Spravato and ketamine?
So Spravado is Esketamine, whereas the regular ketamine is 50% Esketamine and 50% R-ketamine.
Okay. And the difference between S and R-ketamine, do you know?
They are mirror images of each other, two molecules that are mirror images, and they do have different properties in the way that they work in the brain.
Okay. Fascinating.
Esketamine is more dissociative, more psychedelic. R-ketamine likely activates other pathways that might have antidepressant effectiveness that Esketamine doesn't. There's a lot of research still to be done there. Okay.
Fascinating. And so a lot of clinics like Cura, who you work with, correct? Yeah. So you're the psychiatrist at Cura. They all offer multiple modalities. Does Cura offer both modalities?
We offer the Spravado Esketamine.
Okay. Just the Spravado.
Because then Spravado could be administered intravenously, intramuscular, intranasally. That's not Spravado. There's many different ways that it could be administered, but Spravado is the FDA-approved version, correct?
Yeah, so Spravado is the FDA-approved Esketamine nasal spray. It's this one right here.
Okay.
The first FDA-approved psychedelic. And so in a 2-hour session in the clinic, you just go ahead and spray the Esketamine into each nostril and have your experience.
And at what point are you ego disillusioned?
Usually within about 5 to 10 minutes, you'll feel the onset.
Okay. And do you feel like everyone that goes through it, because if it's weight dependent, does everyone that go through it usually go through an ego disillusionment, or is it usually kind of case by case?
It's case by case.
Okay.
So we have 56 milligram formulation and 84 milligram formulation of the Spravado. And so people that have larger body habitus are going to have, potentially a less strong experience than someone who weighs less. And some people are just much more sensitive to ketamine and to psychedelics than others.
Regardless of their size.
So
you'll have, some like a bigger person even have more intense experience if they have that sort of subtle acuity or sensitivity.
Yep, absolutely.
Fascinating.
And when you're going into like a Spravato session, like somebody's about to start Spravato, do you typically like just start them off at the lower dose to like the initial onset and just be like, let's see where you're at with this first dose, and then kind of take it from there?
Totally. We start with the 56,
okay,
see how you do, and then there's the option to increase.
Interesting. Okay.
Have you ever had a patient that has been in the midst of the ego disillusionment and they're like, I want to hit the eject button, get me out of here?
Absolutely.
And
wow.
How do you do that? What do you do?
Well,
is there an eject button?
Yeah. Once it's in your bloodstream, it's in your bloodstream.
Yeah.
Right.
You're here forever, Cindy. Sorry.
You've gone down the rabbit hole. There's no way out. No.
Bye, Alice.
You just got to follow the white rabbit. And then it's all good. Yeah.
She's like,
no. So the best thing is just to go into it with as calm a mindset as you can.
Yeah.
So to go into the experience relaxed and knowing that your breath, slowing your breath down, can go a long way towards regulating your nervous system so you don't feel overwhelmed.
Okay.
Are there tools? Obviously, I know every Spravato session, like you have like you can set it, right? Like your intention for every session. Can you walk me through just like what a typical or like a standard session looks like from patient walking into the door to the patient leaving and getting their ride back home?
Yeah. So typical session, you'll need to get a ride to the office because you can't drive yourself home.
Makes sense.
And we do measure your blood pressure ahead of time to make sure it's not too high, because ketamine can raise your blood pressure.
What happens if it is too high?
If it's too high, you can take a little bit of a medication to bring it down into a safe level.
And then you'll recheck it again. Okay.
Yep.
Seems very safe.
Very safe. Absolutely. Yep. And you take the medicine, and there's therapeutic support if you need it.
Okay.
If you feel like it's too intense, you can ask for help, and someone can help you to, again, a lot of it's breathing, relaxing, just knowing that you're going to be okay.
Yeah.
You're going to come back. You're not going to get lost.
Yeah.
It's going to be fine.
Yeah.
It's a transient state where you feel like it might be too powerful or too strong.
Do a lot of people opt in to like listen to music or try to journal?
Yes, we recommend listening to calm music.
Okay.
And having an eye fold on so that you're not looking around the room. That can help reduce the nausea.
Okay, gotcha. What is if somebody does experience nausea? I've heard that's a common side effect.
Yeah.
I obviously it's a nasal spray, so I'd assume there's probably like some type of post-nasal drip that's probably not the best. Is there anything that can kind of subside that, like candy, mints, anything like that?
Yeah, some people like ginger chews or candies beforehand to calm their stomach.
Yeah.
Or you can take a medicine like Zofran to
Okay.
help reduce the nausea.
That's helpful. Yeah.
You see, I tell my sister, I've gone through a few psychedelic experiences, and they've been great. They've really helped me shift my perspective. Some of them haven't been great, but they've all led to really good insights. And I was talking to my sister the other day, and I come from a family of 5. We're all a little bit like fucked up. And I was like, I think everyone, all of the siblings, would benefit from like a psychedelic experience. Just like getting out of your waking state of consciousness, getting a little bit of shift of perspective. And she was like, absolutely the fuck not would I ever do that. There's no way I want to get out of this waking state of consciousness. If you told her that she'd get nauseous and then she'd have a post-nasal drip, that would even put her further down the no path. So what do you say to those people that are like hesitant? Obviously, you have to be open to the experience, but we also know how effective this treatment is. So those like anxious people that are kind of hearing all these things and they're like, no. What do you say?
You want to emphasize how helpful it can be on the other side. And also you want to validate those feelings that they're having, right? You don't need to push it away. It's totally normal to be anxious about a new experience that's unpredictable, where you might lose your sense of self, right? And so again, helping them to calm down, just like, hey, it's very normal to have this experience, but it can be really helpful. We can start with a really low dose and just see how you feel. There's no pressure to commit to anything bigger, right? It's like training wheels. Start with training wheels before you take them off. They don't have to ride on their own, giving them that level of support.
100%.
Yeah.
Something makes me feel like you'd be a good person to hop on the bike with and have the training wheels. You're not going to fall. You got it. Just breathe.
Totally.
Yeah. That's awesome.
Do it together.
And we've talked a little bit about obviously some of the side effects and potential concerns. I'm curious, what are some of the outcomes that you're seeing positively for patients that are suffering with treatment resistant issues?
Yeah. So Spravato, ketamine can be great for people with treatment resistant depression who haven't responded to other treatments. And the main benefit of ketamine is how quickly it works. Within 2 hours, 24 hours, you can get a full effect.
Opposed to meds, which can take how long?
Meds can take weeks.
Yeah.
Wow.
TMS can take weeks to kick in. So if someone's suicidally depressed, ketamine can be one of the fastest acting treatments. Other than ECT, which is electroconvulsive therapy, which you have to go to an inpatient hospital for.
One flew over the cuckoo's nest.
One flew over the cuckoo's nest. You have to undergo anesthesia, paralytic medicines. It's a controlled seizure. Half the people end up with memory impairment after ECT. So ketamine is much more accessible, much cheaper, and works really quickly.
Sounds less painful too.
Yeah.
And less painful.
No cuckoo.
And less side effects long term.
Right. I was going to say, man.
You said that you were dealing with some suicidal ideation and ketamine helped?
Yeah. Just a past experience. So I have struggled with addiction, and this was a couple years ago, and I lost a really prominent grandfather in my life suddenly, and was unfortunately in the grips of addiction with fentanyl and benzodiazepines, and decided to I'm just gonna end it. There was no hope, and I had made a decision. Well, I didn't make the decision. The paramedics made the decision to take me to the hospital, and this doctor walked in, and it was in San Diego, and I was like, "Look, bud, I'm gonna be honest with you. There's no hope for me. I'm severely addicted to fentanyl. I'm severely addicted to benzodiazepines. Anything you give me is not gonna help." And he was like, "The only thing I can give you is ketamine right now." And I was like, "Okay." I was like, my whole head turned around, and I was like, "I'm ready, bud." He was like, "I don't think you are, but okay." And so he was like, "All right." And he was like, I don't think that you need a psychiatric hold. I think you're in a desperate state of hope, and you need treatment. And this is the best thing that I think can give you a boost to get your butt in treatment and kind of get you enough strength to kind of give yourself that push. And a nurse came in, stuck me in my butt, and I was like, "I'm ready." You know what I mean? Especially as a drug addict, you're like, "Oh, more drugs, awesome." But man, I was in for a surprise. I think I was I don't know what dose they gave me. I didn't ask, because immediately as soon as that happened, I was just glued to the bed, and I was it just in a I literally could just be in a hole. It was just experiencing. I knew where I was. I knew I was in the hospital, but after I kind of came to, I kind of just sat up in bed, and I was like, "Okay, let's go pack our stuff and let's go to treatment." And it did take me some time, but I did the suicidal ideation went away. I was no longer suicidal, and I had enough strength to keep going for the next couple of weeks until I landed in a safe place. So it was extremely powerful. I wish I could find that doctor, because I would love to give him a call and be like, "You absolutely saved my life." And I think they should use ketamine in the ER, especially for patients like that or experiencing those symptoms, because that was the first I ever heard of it. And I was like, "This guy's crazy," or he's just experimenting, And this was 2021, I think. So really early on. Yeah.
He's following the evidence.
Yeah. Very, very powerful. So it's interesting. I just never had heard of it before.
That's amazing that it works and you're still here. Shout out.
Yeah.
100%.
Shout out.
Do you have any knowledge around ketamine being used for addiction? Because I know obviously, there's this kind of cultural taboo of, addiction with ketamine, but inversely, I've also heard that it can be really helpful for addiction as well. Is that right?
Yeah. I mean, it depends on the case, but some people's addiction is related to having chronic depression, anxiety, PTSD, right? And so if that underlying condition can get effectively treated, then they may seek less alcohol or benzos or fentanyl. Yeah. And when it comes down to it, a lot of it is harm reduction, right? So while ketamine addiction and abuse happens, one of the questions is that less bad than being addicted to alcohol, fentanyl, benzos, right? Cocaine, these other things.
Much rather have somebody coming into the office for Spravado treatment in a controlled environment than being out, using some God knows what that could end their life. And I think it's like a very different, obviously it's still like a substance, right? Like a lot of people who are in recovery, I think are like, I can't go down that path, but I would much rather do that option, like go through that option than the latter, So I think it's a helpful tool. Absolutely.
When I was working at the clinic in Santa Monica, it was such an interesting dichotomy because you had people walking out of treatment being like, I just saw a loved one that just passed away, or I forgave a past abuser. And I was like, that is amazing. And then people would walk in, it was a busy, heavy foot traffic street, and they were like, how is this even legal? Like, you're getting people addicted to this substance. So it felt like there was such a strong pull of both sides. What do you say to those individuals that come from a substance abuse background? Like, there's people in AA that are like, no, like sobriety is no substances whatsoever. But I think there's a good amount of fear around like addiction and like, I can't take the substance because I'll get addicted to it. You feel like that comes up at the clinic?
Yeah. So ketamine addiction and abuse is a real concern.
Yeah.
It's something we have to be vigilant about, making sure that we try to avoid and mitigate in the ways that we can. That being said, right, it's very rapid acting in the way that it helps people with suicidal depression, and it's more accessible than any other treatment really for that. So we have to weigh the pros and cons. And in terms of people who really take the abstinence approach, right? So a lot of the kind of hardline old school AA folks, right? They'll say, don't take any ketamine to try to treat your depression because you're just doing more drugs. I can understand that perspective, honestly. At the same time, I think that there is a balance, right? And I think that it's interesting to even consider that AA was founded by Bill, right? A man who
Dr. Bob and Bill,
supposedly used LSD
he did.
in his realizations and revelations that led to him creating AA. So, it's a mixed bag with all this kind of stuff. It's so complex with mental health, and I've seen people's lives, get derailed with ketamine addiction. I've seen people go to rehab for ketamine, right?
Yeah.
But it's not most people that have a ketamine experience that end up in that situation, for sure.
Yeah, because we talk to providers all the time, and they're like, we have a call center and care coordinators connecting various patients to these clinics. They're like, well, we don't want drug seekers. And working with my background in a bit of substance abuse recovery, I'm like, listen, if someone's going to be searching for drugs, it's not going to be 54 milligrams nasal spray twice a week. You know what I mean?
Right.
A,
Exactly.
it's not worth it. But B, they'd rather find it on the street and probably something a bit stronger, know? So yeah, it's funny around these ideas of like addiction and kind of looking at it from different lenses.
Yeah. And you mentioned that like, obviously that is an instance that we need to be aware of and cautious of, but it's not the experience of most people. What is the experience of most people in your eyes?
Yeah, I think the experience of most people is that it's a relatively mild experience. It's not super intense for them. And they get rapid relief from depression, anxiety, suicidal thoughts. And they get perspective oftentimes as well on their life, on what their problems are. They get out of the default mode network is one way to describe it.
Sure.
Right? So oftentimes when people are depressed, they're ruminating, right? They have negative self-talk. negative core beliefs, and they're stuck in a pattern of brain activity that becomes very constricted and constrained. And what the studies show in the fMRI brain scans is that the Spravato and the ketamine can help people get out of those ruminative negative brain circuits very rapidly and very reliably.
Wow.
It's amazing. Yeah, I mean, I can speak to my own experience when I was in my own bout of depression and even suicidality. There was almost, like you were mentioning, this rumination, this perpetual biofeedback loop, you know, of like negative thoughts create negative emotions, create negative thoughts, right? And it would just continue like happening. It sounds like, based on your experience, ketamine allows you to kind of zoom out and have a paradigm shift, almost like shaking the snow globe. What other kind of analogies do you use to kind of describe the experience to your patients?
Yeah, the ones you described are great. Also, getting out of the old programming. Yep, the old mental programming, right?
Especially out of the matrix.
Out of the matrix, yeah. Out of the dystopic thought patterns, because those of us that have had, you know, adverse childhood experiences and early life stress, what happens is it reorganizes the brain networks to have, again, negative core beliefs, negative self-talk, ruminative patterns, and they can become so entrenched that to get out of them requires pulling a significant lever, right? So it's really getting out of the old programming and getting into new patterns of brain activity. That's the opportunity.
Obviously, this is to treat depression, right? It's on label to treat like treatment-resistant depression. I think the very common question that I get from a lot of people that inquire about it is, can this also help with other mental health conditions? Obviously, depression is what it's treating, but I think with depression creates rumination, right? Like obsessive compulsive disorder, right? Or trauma is obviously maybe something that's connecting to the depression, or even just anxiety from, I mean, there's so many different conditions, right? And we could go into a list of them, but can this also help combat some of those other conditions?
Absolutely. Yep. So transdiagnostic is one of the words we use clinically to describe something that can treat many different conditions. Yeah, the Spravado can help depression, anxiety, suicidal thoughts, OCD. There's research to show it can help with addiction. A lot of different things.
Yeah.
Yeah, and I feel like the baseline of a lot of these things is like either depressed because you've had adverse childhood experiences, or you might just be going through a rough patch, broke up with someone, or like, you know, life is just dealing you cards and you got a rough deal for that season. For me, I did the ketamine treatment, but I never was like traditionally depressed. I would say I would lean like more anxious and like affective anxious. But when I went through the treatment, I had all those things happen to me, and I really worked through grief and having no idea that that was something that was underlying on a few of these various issues. And then the death happened like years prior. And it's interesting how it could kind of bring certain things up to the surface that you don't even realize that is still like bubbling underneath. But like to your waking state of consciousness, it's like, no, that kind of happened, but like we keep it moving. And then when you get into this altered state of consciousness, it's interesting to see some of the things that are brought up. And then you're kind of like forced to either like lock it in the closet or work through it. And I really feel like contrast isn't supposed to last. It's supposed to teach you something. So it's like your job to work through that lesson, you know?
Totally.
So I'm sure like a lot of things come up with people. Do you guys have like an integration protocol, or like what do you do when people do come face to face with these tougher experiences?
We definitely recommend therapy to work through it, talk about it. You don't have to be alone in that experience, and it's really helpful to express, to get it out. Yeah, talk about it.
And now, if you are recommending the therapy, would you say that if a patient is doing the Spravado treatment and therapy, like running parallel with that, is it helping them more than the patients who are not?
Yes.
Okay.
I would say so. Absolutely. Yeah.
And then when you're doing therapy, do you do therapy in the same room, like while you're under Spravado, or is it like separate and
post Spravado?
It's separate. Yeah.
Okay. Interesting.
Yeah.
And would you recommend just any old therapist or someone that has experience with ketamine?
Any therapy can be helpful.
Okay.
Someone who's a professional trained therapist.
Yeah.
If they have extra training in ketamine therapy, that's an additional plus.
Okay.
Yeah. And we talk about, is Spravado a psychedelic? Which I feel like we went through and really got a deep understanding of Spravado as a whole. Do you feel like Spravado is going to be laying out the groundwork for some of these other psychedelics that are being researched right now? And do you have anything to say about those modalities that are kind of in the pipeline?
Yeah. Spravato and ketamine are the first in class, you could say, as far as the medical administration of psychedelics. And there's the REMS program, right? The Risk Evaluation and Mitigation Strategies program.
So what's that?
It's an FDA required program in order to make sure everything's safe with the use of Spravato and ketamine.
I'm sure that derived out of maybe the opioid crisis.
Yeah, exactly. Yep. And so moving forward with psychedelics, I believe that the REMS programming will be required, and it's a good thing.
It's important. And then what about the other modalities that are kind of being researched right now?
The other psychedelics?
Yeah.
Yeah. So it looks like psilocybin may be next in line.
Okay.
For FDA approval.
So magic mushrooms?
Magic mushrooms.
Whoa.
Yeah.
And then is it for depression as well?
For depression.
Okay.
Yeah.
Fascinating.
Yeah.
Yeah, and to your point, I think it's going to have kind of this unconventional sort of logistics around it too, right? Where you have to probably be supervised by a medical professional for a certain amount of time and mitigate that risk, if you will, which I think is a really important variable too, because a lot of these substances have the ability to completely transform individuals for the positive, but then also we've kind of discussed some of the negative things that we need to be privy to as well. Beyond the REMS, like what other sort of kind of protocols or I guess just any sort of guidance that you give to your patients like prior to treatment? How do you kind of set them up for a successful course of the induction phase, if you will?
Yeah, so preparation for the Spravado and any psychedelic is really important. I would say meditation, mindfulness, breathing exercises, anything that you can do creatively. I like to encourage people, if they like to do arts or music or dance or poetry, to engage in those types of activities because it really exercises those brain networks. And so I really recommend as well people not to have a stressful conversation or argument or anything that's going to activate their fight or flight system right before going into a session. Because that'll influence what content comes up in the session for you.
Right. Yeah. And I take it like no other kind of substances prior to, no alcohol, things of that capacity.
Right. Absolutely. Yeah. And doing therapy beforehand, journaling.
Yeah.
Just prompting mindfulness.
Mindfulness, having an intention can be helpful going into it.
Yeah. And the idea of an intention can be kind of arbitrary, right? It's kind of like what does that mean? Like obviously the intention is to get better from depression, but when you kind of prompt somebody to set an intention, how do you go about doing that? What sort of questions do you ask?
Yeah, you could ask somebody what the purpose of them coming to the treatment is for personally for them. And intentions can be really broad or they can be specific. You can say, I want to work on this grief that I'm experiencing right now at this particular point in my life, or my intention is to let go. Right. So really it's meeting the patient where they're at. Yeah. And there's no single right way to do it. Right. Yeah. It's just what's personal.
I remember being at the clinic and I would like try to help people set intentions, just like being the front desk. And I feel like at the end of it, I got good at it because it was like, okay, so when we come in, they're like, I'm trying to work through anxiety. And I'm like, okay, like what causes you the most anxiety throughout your day? Work. Okay, what elements of work create anxiety? And it's almost like kind of leading it back, like question after question. And then like, finally enough, they're like, I'm unfulfilled. And I'm like, you're ready to go in now. You know what I mean? And I'm like, see you on the other side, Alice.
That's a great methodology. Yeah. It's like about finding the root cause, right?
Yeah, it's like pulling it back.
If it's too arbitrary, then you're kind of, I think, kind of short, like making it rather elongating kind of the treatment results. You know what I mean? Because if you have that specificity and granularity on the root of the cause, you go in with that clarity and you can just know exactly what to address, what to let go of, not just letting go, you know? So.
Yeah.
And humans, we're very suggestible creatures.
Yeah.
So if you're telling yourself going in that I'm going to work on finding purpose in my life, right, then you may be more likely to do that.
100%.
And at the same time, you want to be careful and hold it with some openness as well. Because if someone has the impression and the expectation that going into the session, they're going to find their purpose in life, and that doesn't happen, and they're like, I just saw some colors and things moved around a little bit, the session was a failure, I didn't find my purpose, right?
And then it's not going to work the next time.
It's anti-therapeutic to do that. So you want to emphasize that.
Open but closed.
Oh, exactly.
Yeah. I remember one really bad experience at the clinic, and it was this elderly woman. She was like 60. And like beforehand, she was like, I'm just like afraid of dying, And I was like, I don't got any wisdom for you. And I'm like, best of luck, Alice. It was a horrible 2 hours. And she got out and she was like, I had very vivid, like dreams of death and like blood and like deep red. And I was like, I'm not a mental health professional, and you need to go find some help.
You want to schedule your next appointment? I can help.
Exactly. I'm like 988. God forbid shit gets real. But I think kind of to your point, where she was almost like super hyper focused on this, or maybe like didn't have the ability to like float down the river, so kind of got like stuck on a branch a little bit. So it's like being able to be open and specific, yet not specific at the same time, which is really hard to tell somebody. Because I remember going in and like the first experience that I went through and I really saw grief, I was like, I would get stuck in between places where like if an expectation came up and I had an expectation violation, I would like freeze, and it would be really hard for me to like readjust in real time. And I was like, that's the thing that I want to work on. And then I went into the experience and then I saw my dad and I was like, what the fuck? But it was like more about how did that come to be, and being able to have certainties in your life when maybe when you were younger, you didn't have certainties, right? And I was like, ow. And I would have never gotten there, I don't think, with a therapist, to be honest with you, because I wasn't like, yeah, this is like happening to me on a day-to-day basis. But it was almost like, specifically not specific, and I got exactly what I was looking for. So it's interesting to be able to have that kind of like push and pull, and I think what also works for some people doesn't necessarily work for others, and maybe some people are more introspective than others, so it depends.
It's always case by case with all of this, and learn as you go.
Yeah,
definitely.
What are some of the most common cases that you see? Like grief, obviously being a big one. What other sort of cases?
Any childhood trauma, eating disorder, like what kind of comes up?
I mean, chronic depression that stems from early life stress and trauma. Super common.
Like early life stress, like in what way?
All kinds of ways. Yeah. I mean, I wouldn't say there's a particular category of stress more so than others, but just adverse childhood experiences.
Like family stuff.
So relational trauma that comes up in family systems. It could be capital T trauma in terms of, a single event that was in particular, especially traumatic for them.
Can you kind of walk back what capital T is versus like lowercase t trauma?
Yeah, so capital T trauma just being like one particular event where you almost died or you witnessed someone dying, right? Or you had an assault. Versus lowercase t trauma being something that's more chronic over time, like a family system that's dysfunctional, right? And so, that's one root cause of people coming, to the clinic to treat their depression for. But it could also just be no particular reason. Just I feel depressed. It's as a condition of maybe our society and the times we're living in. We know depression is on the rise, right?
Yeah.
I'm telling you, like I searched Washington, D.C. because I was talking to someone that was in Washington, D.C. and there's like a tornado warning. And I was like, I wanted to see if there's what's going on. And I search it and the first like 6 things that come up on like Google News has nothing to do with tornado, and it's basically like the world is ending. And I was like, and I just like, get out of here. I was like, bring me back to like my TikTok where like all rainbow and sunshine.
Teaching how to knit.
Yeah, exactly. I'm like, crocheting, TikTok, thank you. Yeah. But I can only imagine if you live in that world of the algorithm or just like the news and like how like cortisol pumping day-to-day activity could be. And my day-to-day is relatively at times like you get a bit of cortisol, which I think is good, but like overstimulation of all of these kind of like horrible things.
I also think that's getting worse just with the access. Like, I mean, I can just think back to even just my mom's generation, just they were reading like encyclopedias, you know, to get information.
Scholastic.
They would literally be like, my mom would be like, go get the encyclopedia to look something up. But now that we have such a, like at the fingertips, everything that we could possibly want at our fingertips to just look, I can imagine how that is just a growing epidemic of depression because of how many people kind of get lost or stuck in, oh my God, what's going to happen tomorrow?
Yeah.
What if I'm not here? Do I have to go to work tomorrow? Should I go to work tomorrow?
Yeah.
All these questions, gas is, you know, up or whatever it may be. So I think that's, I would imagine is causing a huge impact on people, and it will continue that way until we're like, the phone, I'm getting a flip phone. You know what I mean?
Jeffrey Epstein holes.
Yeah,
cause
exactly.
depression.
Yeah.
To be honest with you. I'm like,
Definitely.
No, 100%. Whether it's like devices or diet or all these sort of systematic societal patterns, right, that are kind of taking us away from our innate human desire to like just be a human being and explore nature and get sunlight, so on and so forth. I'm curious, like we've discussed obviously Spravato and ketamine, and obviously there's medication and TMS, all these modalities that you administer to kind of remit depression or whatever. What other sort of lifestyle tweaks or mechanisms do you recommend to your patients in addition to some of these treatments?
Yeah, exercise is huge. That's almost as good as taking an antidepressant.
And that's on hot 8.
Yep.
Yeah.
How about
Yoga, running, going to the gym, playing sports, you know, socializing, super important. Feeling connected, huge in terms of mental health. Yep. So yeah, get your body moving, connect with friends, with family, with community. Diet is huge, actually. When we eat, you know, a lot of processed food, it can promote inflammation in the body that feeds back into the brain and can promote depression and anxiety. And then also sleep is really, really important. It's a cornerstone of all health.
Yeah,
for sure.
Yeah, it seems like that should be the first line defense, huh? Before you even entertain whether it's ketamine or meds or anything outside of, you know, just being a healthy person.
Absolutely. The lifestyle factors are critical to address.
Yeah.
And a lot of people do address those and are still depressed.
For sure.
Right?
Yeah.
And a lot of people are so depressed, they can't find the motivation to make the changes.
Why would I go hang out with friends or go out and see, get sunlight?
They're isolating. They're not committing to exercise routines. They're not able to make the choices to pay more money to eat organic, healthy, whole food or whatever.
Yeah.
And so sometimes the treatments like the Spravato, the TMS, the medications can help to pull that lever to allow them enough alleviation of their symptoms that they can start to make changes to enact a positive feedback cycle rather than be stuck in the negative spiral.
For sure. And it sounds like Spravato has that fastest time to value, if you will, right? So somebody who's really looking to get that spark to get them back in that momentum, it can kind of, you know, within sounds like a day or two, be able to do that, which is amazing.
Hours. Yeah.
Incredible.
Wow. If there's one last thing that you could leave the listeners with about Spravato, what would it be?
About Spravato? Yeah, I would say reach out, get some more information about it. You're not alone in the journey. You're not alone in the difficulties of life and what you're experiencing with the challenges. So absolutely, you have the benefit of access to therapies that are very helpful. And there are people who are ready and willing to talk to you about it and support you.
And where can people find you?
Yeah, you can find us curabh.com, Cura Behavioral Health. Yep.
Amazing.
Awesome. Well, thank you so much for the time today, Dr. Kevin. It's been a pleasure. Thank you for educating us on Spravado and all these other modalities as well.
Thank you all so much. Yeah, my pleasure to be here.
Very insightful.
Thank you.
Got a lot of information. So thank you.